Good afternoon. Good afternoon. Y'all know that beat gets me going every single time. I love to groove. I love to move a little bit, especially when we're bringing Transformation Thursday to you because we understand that we're taking your lunch hour or just a few minutes of it to give you some community food, some soul food if we were in the church, some spiritual food, as some of us preachers and ministers like to say. But to accompany what you're doing on this Thursday, June 9, we welcome you to Transformation Thursday. I am Duran Talley, Public Information Director for Northeast Delta Human Services Authority, where our vision is to build a unified Northeast Louisiana where individuals are thriving and reaching their full human potential. Our mission is to serve as a catalyst for individuals with mental health, addiction disorder, developmental disabilities to help those individuals realize their full human potential. And we do that by offering quality, excellent care with greater accessibility. Three tenets guide our actions every single day: greater access to services, excellent customer service, and quality, competent care. Good afternoon to you, Ms. Joyce Hendricks. We definitely want to thank Dr. Montez A. Sizer, our executive director, our visionary, for allowing us another opportunity to share with you the great work that we're doing in transforming this region. And of course, before we even get started, we want to encourage you, if you or someone you know struggling in the areas of mental health, addiction disorder, or even have developmental disabilities, call our crisis hotline, 800-256-2522. And we are available to you 24/7. But guess what? Northeast Delta Human Services Authority cares so much about this region that we don't encourage you to only come to us when you're in trouble or when you need help. We have a prevention and wellness department that has programs that start as early as our early childhood program, school programs, where we're looking there. We're in the middle school, junior high programs with signs of suicides. We have high school coalition and student ambassador groups, but we're looking at the whole human. And part of that prevention work and wellness work also entails our work around opioids. And we know that the times that we're in today, we turn the TV on any given day. You even get on your social media and we see Louisiana State Police has made a raid or has arrested or maybe even have saved the life of someone who may have attempted an overdose or just misusing and abusing prescribed drugs. And many of us may be guilty of misusing what is ours that we did get from our local drugstores, but we misused the intake. And so we do have prevention programs, we do have awareness programs that we want to bring to your attention as well. And so today we actually have our opioid expert, Miss Kara Etienne. She's one of our managers in the prevention and wellness department. She's going to come and talk to you a little bit about what we've been doing all year long around the opioid epidemic, and then this great event that we have coming up 1 week from today. So, Kara, welcome.
Hi, Duran. Thank you for having me today.
Glad to have you. Kara, first off, just tell me about the great work that you do in the opioid recovery program.
Okay, so as you stated, I am the opioid use disorder prevention manager. I know that's long. Um, so we usually just say OUD. That's kind of the acronym for it. I manage Northeast Delta's state opioid response grant. With that grant, we provide a variety of services. But one of the things I want to make sure I point out before I start listing some of those services is that everything we do is at no cost to those who live within the 12 parishes of Northeast Louisiana. And those are the parishes that we serve, Northeast Delta serves. Some of the things that we do, I won't be able to cover them all. We have only a short amount of time, and I understand that we have people's lunch break. But we do, our biggest thing is our Narcan training and distribution.
Mhm.
That is an opioid reversal drug that reverses the effects of an overdose. And what that means is when an overdose occurs, breathing slows, heart rate slows, And if you don't get emergency medical care in a timely enough manner, the likelihood of someone dying is very high with that.
Mhm.
Narcan goes in and it reverses that. It actually knocks those off the receptors in the brain that control your breathing and your heart rate.
Wow.
Anyone can administer it. It's not something that is very technical. It is a quick and easy. This is our box. This is how it comes. We call this a kit. And inside of that kit is 2 doses.
Mhm.
Very simple, very easy. I'm not going to do anything beyond showing it because we have some other information on how you can receive that. We also do our safe medication storage and disposal. With that, that is our prescription drug drop boxes that we place. That
Mhm.
is our prescription lock bags that we deploy and provide to citizens within our area. This year, we have placed 2 drop boxes. We placed one in Jonesboro, Louisiana at the Jonesboro Police Department, and then we also placed one in Richwood at the Richwood Town Hall. We have others that are placed throughout the region. One that I'm really proud of, our prevention coordinator, it was placed before I started by Miss Latanya Owens, but I'm still proud because it's in my hometown of
There we go.
Louisville. So I want to make sure I always let my hometown know that there is a drop box there and available. You can go on our website and find where we have the others listed, or you can contact me and I'll be able to help share that with you. But they are distributed throughout our region. We currently have plans to place 3 more.
Wow.
I'm just waiting on them to arrive. And once they get here, we're going to be dropping them. I like to say they're called drop boxes. So I always say we're dropping boxes. We drop and go.
Yes,
So
indeed.
we do that in our medication lock bags. We understand, we know, like you mentioned in your introduction, that a lot of times it's also misuse. We
Mhm.
understand and know that there are situations that call for people to have prescription opioids. However, we want to also say that while we're aware of that, we want to provide them with safe means of actually safely storing those medications.
Mhm.
Studies and statistics show that a lot of times, more often than not, most populations, when someone is aware that you have them, they're taken advantage of. There's always, in my analogy, or one of my stories that I like to tell, is that there's always someone that goes to check on grandma, and while they're checking on grandma, they're pinching off her pills.
Mm.
So so if
This is
we
true.
have those, we have medication lock bags that we can take and you can actually lock your medication in. You have a key. You don't have to lock them all up, but you lock those opioids up and you can't get into this bag. You keep the key in a safe location. And so either it's yourself or whoever is your caregiver that is a trusted source can then go in when it's time to administer those opioid pain meds and be able to provide them to them.
Wow.
Um, so those are 2 of our biggest things that we do, along with our deterra pouches.
Mhm.
That's the way to safely deactivate. You think about, you go to the dentist and you have some dental work done. Depending on what it is, you may get a prescription pain med. Let's say you only need 1 or 2. If they prescribe you 10 or 15, you may only need 1 or 2. So what do I do with the rest that I have left? Well,
Mhm.
you can safely deactivate it by pouring it into that deterra pouch, mixing it with water, and throwing it away because you no longer need it.
Mhm.
We don't, it's not environmentally friendly to flush, and we don't recommend that you throw them in the trash.
That's a good point.
And the other thing that I do, we manage, is a crisis mobile team.
Mhm.
That is a team made up of 3 different disciplines. There's a grief counselor, a nurse, and a peer support specialist. So we go out into the community. We provide grief counseling groups at no charge
Mhm.
that kind of deals with any loss. Most times when people hear grief, they think death.
Mhm.
We're trying to change that narrative and let people know that grief is any loss of
Mhm.
any kind. It's the loss of your livelihood. It's the loss of relationships.
Mhm.
We know, and we all know someone or seen someone that struggled with substance use disorder, and it changes the way that they look. So you think about what that person feels every time they look in the mirror and they see what they have lost within themselves.
Mm.
And so that's what our grief counseling does. It addresses and works to heal those losses that we don't typically think about or we push to the side,
Mhm.
and not understand how those losses serve as triggers to
Mhm.
use. We
Wow.
do SBIRT screening, which is screening, brief intervention, and referral to treatment. That is what our nurse does, in addition to doing the Narcan training. And then our peer support specialist is someone who has a lived experience with substance use disorder. I always highlight that first, in order to become a peer support specialist, they have to have 1 year of recovery.
Mhm.
So that means that they have successfully, once they've left treatment, they have been able to maintain their recovery for a full year. And they come on board then and they work with us, basically almost like a cheerleading and letting those people know that we come in contact with substance use disorder, is that it is possible, it is achievable, it is attainable.
Mhm.
I'm doing it.
Wow. Wow. As we know, we see, and again, like we talked about it earlier, we see it on the news all around us all the time. Some of us may know folks, some of us may be guilty of some misuse ourselves. Uh, and it takes all of these things that Miss Kara Etienne just shared with us to combat, to reduce some of these crises that we experience, and some of these tragic events that we see. There are things that you and I can have in our house right now at no cost that can
Mhm.
reduce the risk, the harm of not just ourselves, but even to our communities and to our environments. When we talk about safely disposing, not putting pills in your toilets and in your sinks, in your trash cans. And so there are resources right now that Kara Etienne and her team can get to us in the community at no cost. And so that's so important. Kara, you talked about a lot of the things, and I've been a witness here for the last year of the great work that you all are doing, from you dropping your boxes to prescription take back days, where
Mhm.
you have folks in the community bringing in those old and expired prescription drugs, to where you're collecting hundreds of pounds of pills. And we all know how much a pill is, how much a pill weighs in our hand. And Kara and her team are collecting hundreds of pounds of these off of our streets. Uh, but Kara, you're building something up here. You've been doing that
Yes,
all year long, and what I understand is a week from today, we're going to have a summit. And when we think
yes,
about a summit, that's a big, that's the peak of what it all takes. And we're calling it the Opioid Summit, openly using recovery, our strategies for rising above stigma. Tell us a little bit about your upcoming Opioid Summit.
yes. Like you said, Duran, it's a culmination of everything that we've done this fiscal year and previous fiscal years. I'm really excited about it. It is not. It is my first summit that I'm planning in this position, but it's not Northeast Delta's. We're returning because the last time we had this was in 2019, prior to the pandemic, basically knocking us all off, and everybody figuring out ways to readjust. So now everything is kind of getting back to normal,
Mhm.
but we're in a place where we realize and we understand the need, and that it's time for us to bring it back, and let's start talking about it, and converging and coming together to realize what this epidemic is and what it is doing to Northeast Louisiana. Number one,
Mhm.
a lot of people do not think that it is an issue, and it is. We have overdose that result in deaths occurring right here. I'm going out, I'm doing Narcan trainings with law enforcement, with treatment facilities, those who are actually living in recovery homes. And the stories that I've heard, it's motivated me and kind of just sparked that fire, lit that fire under me, and knowing that, hey, it's time we come back together and be able to identify what the issue is specifically for our area,
Mhm.
but most importantly, understand what our resources are. So we
Mhm.
have a vast, complex panel of speakers for the day that are going to be talking about multiple areas, from harm reduction, um, DCFS, and that's one of the ones that I'm excited about everyone, but I'm really excited about DCFS. We have an addictionologist that's going to be speaking with us on
Wow.
that day, our grief counselor, the state peer supporter, and then our keynote speaker as well. And that's all I'm going to say on that one. We will be in person at the West Monroe Convention Center.
Mhm.
However, I understand that not everyone, and not only myself, but my director here at Prevention and Wellness, Dr. Carol, and our executive director, Dr. Sizer, they understand that not everyone can always take away a full day from work based on the work it is that we're doing. And
Mhm.
because of that, we're also offering this summit in a virtual platform. So
Mhm.
you can sign on and get all of that information that everyone in person is going to be receiving in live time, right as everyone that is there at the convention center with us will be receiving. We also have an area where we're going to have vendors that are working in various aspects throughout Northeast Louisiana
Mhm.
that we can network and kind of say, okay, this is the service that I provide. This is also something that I can do or I need help with. And so the vendors are able to tell us what they provide, but then we're also able to share with them what it is that we're doing. And we're building a network, a
Mhm.
support system, a framework, a foundation for those who need us here in Northeast Louisiana.
Yes, indeed. Yes, indeed. I'm so excited. For me, this would be my first time attending an event like this, but I'm excited to hear, the various speakers who specialize in these areas, these specific areas. And then I'm excited to see what I take away, right? So I see
Yes,
you all working in the trenches, and I see you all out there on the streets doing what you're doing. But to now go to this event and get it from the folks who are doing the research, the folks that are creating the initiatives and the programs and then implementing. So
yes,
I've seen it so close. So now I'll get a chance to kind of back out and hear high
good.
level what we're really doing to solve this, or reduce this problem we have, not just here in Northeast Louisiana, not just in Louisiana, but across the nation. So I'm really excited about how I'm able to connect some dots in my little head around the little that I've been exposed to.
Yes, and that is what we want to do for everyone that comes in. Everyone is going to walk away with something, with a takeaway.
Mhm.
And also, everyone is going to walk away with Narcan
With the
that
physical
day.
takeaway. So you
Yes,
don't
that's the
you
physical
hit them.
takeaway.
Yes, indeed. And there's free food. And there's free food.
Yes. No cost to attend and only $5 for a full day of CEUs. That's it.
That's awesome. That's awesome. Kara, we have a special, featured speaker, keynote speaker, that I understand has roots right here in Northeast Louisiana, well experienced, well researched, uh, is a veteran, has turned around and served veterans, uh, and is coming back home, or coming back to his background. He's out of Farmerville, Union Parish, but it's coming back to his backyard, these streets, these highways, this community, this region that he was born and raised in. And he's coming back as our keynote speaker. And we actually have him with us today. Kara, I'm so excited to introduce to our virtual audience today that have been engaging already, Dr. Micheal D. Gatson.
Hello, good afternoon, everyone.
How you
Hi,
doing,
Dr.
Doc? How you
Gatson.
doing?
I'm doing good.
Welcome, man. Welcome. Listen, we appreciate your time today. We know you're on the East Coast, an hour ahead. Hope that you've already enjoyed your lunch, but we're going to get to ours. But we can't get to our lunch without hearing some good food from you first, man. And first off, just tell us about some of the work that you do.
Well, currently I work for the VA hospital, and I'm a supervisor at a mental health clinic here in Maryland healthcare system. And I supervise five therapists.
Wow. How did you get introduced, I guess, into this uh, world of mental health, of addiction, opioid, and just kind of into your work?
Well, starting back when I was working in Louisiana, I worked for the state as a crisis social worker.
Mhm.
And then after that, I worked in trauma and prevention at the LSU Medical School in Shreveport
Wow.
before moving to Kansas, starting to work with the VA system.
Mhm. You're coming back home, coming back to your hometown region. How does it feel to come back and serve in an event like this dealing around opioids?
It means the world to come back home to present. It is the foundation for my education, my family, and my friends. And like I said, I started my career in Louisiana. So it feels really good to come back to where it's home. Also, before starting, working for the VA system, I presented at the NASW conference in Baton Rouge, Louisiana, several times. And then after I moved away from the state, I came back and presented for the NASW Louisiana chapter for several different presentations.
Wow, wow. And Dr. Gatson, I'm not sure if you can notice, but you certainly have the attention of our viewers today. A lot of hellos, a lot of hearts and love from the hometown folks, maybe folks even across the nation that are tuned in today. And so certainly you're going to be well received at home. We're excited to have you at home. But I got to ask, and I don't want you to give me a little bit too much, but give us a little sneak peek into what you'll be talking about next week. A couple lines or something like that, just to hold us over.
So we're going to be talking about the pain diagnosis in veterans and versus the civilian population. We'll also be addressing the stigma among drug and opioid abusers. And then we're going to talk about some of the challenges and risk factors in prevention and treatment.
Wow.
And then we're going to give some strategies to address how to treat opioid abuse.
Doc, you just touched me, man, because one of the things that I always try and strive in even in my life is to not just, oh, we have a problem. Oh, do y'all see the problem? Do you all see the problem? But it's, here's some opportunity, here's some strategy, here's some solution, some tactic we can't solve all the world's problems. We can't eradicate absolutely everything, but to reduce, to mitigate. And so I'm glad to hear that with your experience, with your research and information, that you're also going to give us a couple steps, a couple strategies that we can apply in maybe our day-to-day lives, or maybe in our operation of organizations and programs and initiatives. And so I appreciate you already coming prepared to not just tell us about a problem, but how can we solve that problem as well.
Yeah, from a community standpoint, as also health providers as well.
Man, this is awesome. This audience, and again, you see the love continuing to come in. This audience that you'll be in front of, Dr. Gatson, we're going to probably have pastors, clergy there. We'll have other health leaders there. We'll have law enforcement probably there. We'll have maybe municipal leaders, if not mayors, maybe some mayor right-hand persons. And so you will have a varied audience. And I believe you'll be able to give something for each of us or each of them to take away.
Yes, and I'm excited about it, to have so many different people from the community, because it takes a community to address this issue.
Yes, indeed. Well, we're certainly excited. We're not going to take our time too much longer. I'm so excited, and I hope that all of these individuals that have been sending in hearts and loves and kisses to Dr. G, I hope that you have already got your front row seat to the Northeast Delta Human Services Authority Opioid Summit 2022. If you don't, it's available to you right now. And guess what? I have to say this. Seats are limited. We are already almost at capacity. We're a week out. And when I looked at the numbers this morning, we got but a handful of seats left. And so I hope those hearts and loves, I hope your name is already in the number. If not, get your spot right now. Kara, tell us anything else that we may be missing, or what else we may have in store for our folks.
All right. So I want to make sure that everyone knows to go to NEDHSA opioid.eventbrite.com to register. There are multiple tickets that you can register for. One is in person with CEUs, which you will pay for at upon registration. Again, attendance is free. CEUs are $5. If you don't need CEUs, but you want the information, you work with this population, or you have a vested interest in this topic that we're talking about, and you just want to be in person while we're discussing it, there is a non-CEU ticket that you can register for. There are also vendor tickets that you can register for. We have a variety of vendors. We still have, like Deron said, we still have space, but we're almost at capacity. I
A
have one of my
handful.
friends, I have a friend, she has her own counseling and consulting business, and she was one of the first ones that was like, yes, sign me up. I am ready. And I said, we don't even have the link up yet. So she is registered for CEUs and also a vendor. So there's no limit to the amount of networking it is that you can do on this event for that day. Dr. Gatson is going to be available to answer any questions that you may have. He's also going to be with us throughout the duration of that afternoon. So you'll even have a little intimate time with him. And we're going to have some fun. We're going to have a photo area set up so that you can post and hashtag Northeast Delta, because again, we want to get the word out. We want people to know that Northeast Louisiana, Northeast Delta Human Services Authority is leading this movement.
Yes.
We are making a difference and making a change, and it takes us. We are here. This is our community. Even though Dr. Gatson is now on the East Coast, he still has a vested interest in what happens here in this community because he still has family and friends right here. So come out, join us. We look forward to meeting you, having you there. There's going to be some goodies takeaway. It's not just going to be Narcan that you're going to leave with. You're going to have some goodies. We're going to educate you. We're going to feed you. We're going to love on you. And we're going to send you back out to be able to help those in our communities that need it the most.
Yes, yes. Very well said, Kara. Dr. Gatson, anything else you'd like to leave us with?
I look forward to seeing you all next week.
Awesome.
Oh, I see a question. I can't do that, can I? I saw a question pop up.
Yeah, you can answer that.
What's the name of your friend's business? Okay, her name is Chastity Butler, and it is C.A. Butler Counseling and Consulting, the first one to sign up to be a vendor. Okay, the very first one. And then she's also with another, I think she has two, Alliance Northeast or something like that. But again, this also, and the reason that I'm pointing that out is because it takes a network. We all have to think about how we're connected, even in our personal lives, and how we can bring that forth professionally and work together again to address this issue.
Yes, indeed. Yes, indeed. Well said. I know, Dr. G, when you get in town, you're going to have lots of hugs and kisses waiting on you, but I'm super excited to meet you, man, and hear and learn from you. But we definitely want to encourage all of our viewers and listeners, if you already, got more questions. How do we get a medication lock bag?
They will be there at we also will have a vendor table set up. The Narcan, the medication lock bag, again, everything that we have is no cost. So all you have to do is come up and let us know what your need is, and we will be providing them to you. We are fortunate enough and blessed enough that we're not going to have to turn anyone away and say that, no, we don't have enough. And that's our visionary, our executive director that knows. He is big about making sure we have our resources to put into our community. So we will have those, Miss Jacqueline Gaddis.
There's Chastity Butler right there.
There she is. Okay. See, networking, pulling together and working to show how we can address this epidemic. I'm calling on my network first.
That's it. Certainly, we want to encourage you all to follow us on social media. If you're not already following us, we're on Facebook, Twitter, Instagram, LinkedIn, YouTube, and TikTok, and Twitter. We want to make sure that you have access to the resources, access to the information that Northeast Delta is providing to make sure we get this information out in the streets, these resources out in the streets. It does no good for us to hold all these medicine lock bags in our cabinets and in our drawers. We want you to have them, and they're free. So we thank you for your time. Follow us. We look forward to seeing you all next week. If you hadn't gotten your spot reserved, again, tickets are free, but we do need you to get that ticket. They're free, but you need to go.
Vendor spots are free too.
Vendor spots are free as well. Everything is free, but you have to let us know you're coming, because literally a handful of spots left. And we're going to accommodate as best we can, but go ahead and get your name on that list.
Yes.
Thank you all again for your lunch. Kara, thank you. It's always great working with you. I've enjoyed working with you. Looking forward to what we do in the future. Dr. Gatson, this won't be the last time that we work together either.
All right. Look forward to meeting you.
All righty. You all take care. Enjoy your lunch. Have a good afternoon.
Thank you.
Bye.
Bye-bye.